So these next set of exercises are going to be looking at the range of motion of our lower limbs. We're going to go from the top of our joints, so we've got our hips, knees and ankles, and I'm going to show you some progressions, just how to essentially to keep the movement and to hopefully improve your strength, which should improve our function. So first things first, we're going to start with our hips. Quite a common place for us to feel a little bit of tension, a little bit of pain. So nice and simply to start, we're just going to lift our hip. This is our hip flexion, and then back down. And again, if you can see, I'm sitting away from the chair, using a little bit of core stability, coming up and then coming down. Okay, and the next one, we're just going to work on a little bit of hip abduction, so that's bringing our hips out to the side. So we can either do one at a time, or we can do together. Now again, as you can see, my feet are sliding on the floor, so what you can do is you can apply something, maybe like a towel in your kitchen, just to allow the movement to be a little bit easier to reduce the friction. And then next up, we're going to move just a little bit further down to our knees. So what I'm going to do is just straighten our knee, hold for a couple of seconds, and then come back. Again, we're looking to get that full range of movement, a little bit of a squeeze, and then back down. A really nice little tip is when you're doing any of these movements, think about the muscles you're trying to work, even give them a little bit of a tap. It'll just help send those signals from the brain to the muscle and back, and hopefully make the contraction stronger. Also, we're going to look at improving our knee flexion. So you're going to pull your knee backwards, again a little hold, and then forwards. And again, if these exercises are a little bit hard, if you feel like you need a bit of help, a towel would be really helpful. So again, we're just reducing the resistance and the friction in our lower limb. So pulling back and then sliding forward. Now, if this becomes a little bit too easy, if you find that our movements, we're able to sustain them, we can then add a little bit of resistance to our movements. So again, the easiest way for our knee flexion is just to tie this, or make sure it's nice and secure underneath us. Key tip is to not let this band ping back. So again, you're going to contract the leg and then come forward. Another good movement again is to add a little bit of resistance, is more looking at our hips. So a nice movement you can be doing in your chair is to apply the resistance band. Again, don't make it too tight, allow it to be nice and wide so we're not pinching any of our skin. And the exact same thing, we can pull our hip out and then back in. So we're really working our muscles up towards the bottom and all around the hip joint. That's really useful, particularly as we get any pain or any weakness around that hip or pelvis joint. Fantastic, good. I like to do one at a time, so then we're stabilizing with our leg that's not moving, and then we're working the other leg. Okay. Moving down to our ankle. So again, really important to keep our range of movement. This will ensure that we can continue to walk. This will ensure that essentially our ankle joint and our main point of contact with the floor stays nice and loose. So nice and simply, we're going to pull up our foot into dorsiflexion, so toes to your nose, and then we're going to push it away into plantar flexion. So ankles up and down. And again, you can do them together. You can do both feet together when you're sitting. Particularly when we're watching the telly and we're not doing much, these are nice simple movements that we can be doing to keep our legs pumping. Particularly if we've got any swelling, this movement will ensure that those muscles pump away a little bit of that swelling around the ankle joint. And then again, the last couple of movements with our ankles, We've got inversion and eversion. We're not going to get too much range on these, but again, all these little movements really aid us when we walk. And then again, as ever, we can add a little bit of resistance. So one nice way of adding resistance is using the band here. We're going to push away, hold, and then pull back. And again, not letting the tension of the band go. We're just pulling that band back, controlling the movement all together. To make it slightly easier, you can come forward with the band so there's less resistance, and again you can then lean back to make it more resistant. Another nice one for our inversion and eversion is you can have your foot stable on one side and you can just pull your foot in and pull it away. Again, not too much range on this, but really good for that whole ankle strength and stability.